Please give a warm British Columbia welcome to George Barakat, the CEO and co-founder of Jack Nathan Health.
You know, I woke up this morning with some reservations with regards to speaking today. Yep, believe it or not. I started thinking to myself, what could I possibly say to this room full of accomplished physicians that day in and day out are on the front lines, in the trenches, first point of contact, the gatekeepers of healthcare. And then it dawned on me, I am not a physician. We are not in practice management. We, in fact, help physicians control costs and increase opportunities for physicians. So you want to open a medical clinic business because you're a physician, of course. And you believe by doing so, you will provide greater access to health care and flourish financially concurrently. And you will, because everybody needs a physician. But at what cost and how long will it take? Because your financial success is ultimately dependent upon patient traffic. Is it enough to scream at the top of your lungs, greater access to health care this way? All the while, you're screaming and searching for the sign that says greater access to patients this way. Good morning, my name is George Barakat. I'm the CEO of Jack Nathan Health, and I'm honored to be here, esteemed panel colleagues. And special thanks to the Walk-In Clinic of BC Association for inviting me to share our experiences. I'm delighted to be part of today's conference. My remarks today will focus on walk-in clinics as small business as it relates to what we have accomplished, how we help with challenges and opportunities, keeping in mind we are not in practice management. Our focus is turnkey startup, marketing, consistency, and ongoing cost management. Oh, it works. Starting a business can be exciting, rewarding and challenging. Where to begin? Incorporating site selection, signing a lease, drawing up plans, constructing the site, ordering equipment, marketing, social media, allied health, computers, sundries, hiring staff, scheduling, and the list goes on. We can help. That's what we do. 13 years ago, this coming June, we began our medical business journey. It all began with a thought. Wouldn't it be great if the medical experience could be more consistent nationally as well globally? Why wasn't there a national and international healthcare company that was recognized as the trusted brand to visit when medical attention was needed for yourself and family? Whether you were in Canada or traveling abroad, it was very difficult to comprehend that given so many retail brands existed in this world, that the most consistent were only relevant in clothing and food. How was this possible? Why are the golden arches so recognized worldwide? Yet there was no ABC of medical. As rudimentary as this sounded, the question remained. In the beginning, it was very difficult to convince physicians that practicing within Walmart's walls was beneficial to providing access to health care for people who needed it the most, and for the most part, did not have the time or convenience to get it. However, there were a few physicians in the beginning that understood life is busy, and we have been forced to do more with less time. One-stop shop made sense. They found that sign, greater access to patients this way. Dr. Ian Bridger, who is on the panel, was one of those physicians, and in his own words, it took less than 5 minutes to decide to get on board. So, we are a trusted partner of Walmart, and we have been since the beginning when they first acquired 115 Wilco stores in Canada. Today, Walmart operates over 400 locations in Canada. Walmart also operates in 27 countries and is by far the largest retailer on the planet. To date, we have opened 72 clinics in 6 provinces, with 17 of them operating in British Columbia. Our expansion plans include international, and to date we have signed 200 clinics in Mexico, 10 in China, with another 190 in design build in China. Brazil will be coming on board as well. We are looking at approximately being in 10 countries in the next 5 years. From the start, we really believed that this model that we were entering was not just monumental, but it was groundbreaking. We really did believe that we needed a partner, an international partner. There is no larger partner in retail or touches more people on a daily basis than the retail chain called Walmart. They actually see the entire population of Canada every 30 days in their stores. So you can imagine what that could represent internationally or nationally as providing or potentially having a consistent quality healthcare program nationally and internationally. So part of that is we want to share our resources. Once we do open internationally, we're going to have a really deep resource of physicians. And part of our plan and part of our objective is to share that resources and have physicians connect internationally and share medical experiences, provide workshops, have our North American or our Canadian physicians travel abroad and possibly create standards that don't exist in other countries. These are completely sponsored initiatives by Jack Nathan Health because we believe that in partnering with Walmart, we have an international partner in retail that's going to allow us to expand internationally. Therefore, why not take advantage of it, and why not honestly pool our resources? Canada has a very good healthcare program. Let's showcase it throughout the world. The challenges of operating a medical practice. Okay? As a physician, you are challenged to balance the health of your patients with the health of your business. Not all physicians have formal business experience or business training. Even if they hire a business manager, most need to stay deeply involved in the business because they are typically the primary investors. Okay? We can assist. Okay. We at Jack Nathan Health believe that a healthy medical clinic must have a balance, not just rostered patients or not just walk-ins. Offering both is a greater service to the community. Refusing walk-ins, in our opinion, is bad business. If your doors are open, then be open for business. The Canadian healthcare system is open for all Canadians. Accepting walk-in patients is essential to Canadian healthcare. Okay? We're very proud that we partner with some of the best physicians across Canada. Okay? Our turnkey approach works, and so far has worked to date. Okay? We can handle everything from construction management, marketing communications, technology infrastructure, medical equipment and supplies, operations, allied health, supporting relationships between Walmart and our physician partners. Okay. Can fully subsidize the heat, hydro, water. We refresh the clinics every 5 years. We have subsidies on IT equipment and medical equipment, like diagnostic boards, computer screens, printers as well. We offer digital media screens in every one of our reception areas. We have quite the extensive marketing program, including now layered in social media, which if you look on any one of our sites in our Google walkthrough tours, you can actually see the entire clinic at the click of a button. Okay. We have an excellent allied health program. So our allied health partnership revolves around collaboration. Collaboration, obviously, with every healthcare vertical is key. You know, part of our collaboration started with our collaboration between our clinics and our pharmacies. Okay, these are some of the services that we fostered with our clinics in conjunction by collaborating with our pharmacy partners. Patients today want convenient, easy access, and quality health care. We believe that partnering with Jack Nathan offers that. And that's simple. That's our partnership formula. Physician partner plus Jack Nathan Health plus Walmart equals a successful medical practice. Thank you. That's it.
Turn on the mic. Any questions? I want to ask George a question, go ahead, which I asked him in the washroom of all places. But I told him the business model of putting these clinics in Walmart was brilliant. And he told me a very interesting story on how that came about. You want to share that? You got to clean up the language a little bit.
So just to give a bit of history, I've been a partner personally with Walmart for 23 years in the hard goods side. We had a family business that was established in 1978 that we manufactured wall decor in Ontario. You know, but they stood by us. They understood that this wasn't about prescriptions. This was the right thing to do. When you touch that many people on a daily basis, monthly basis, they see between 200,000 and 500,000 people in their store per month. There is a corporate responsibility. So they got it, they stuck by us, and here we are today, expanding globally with our partner. And we're very proud to be partnered with them. So,
George, why did the first two fail?
we didn't really understand our model and how our model needed to be. And of course, back in the early days, we were kind of green and wet behind the ears on developing the model, and everybody came out of the woodwork thinking our idea was great and wanted to jump in front of it. So there was a few different aspects that we had to contend with. But nevertheless, as I said in the beginning, we are not in practice management. We clearly understand our model. But we want to do everything we can to help your model become successful. And along the way, if we can utilize Walmart's name, brand, and prowess in the retail industry to expand that conversation globally and showcase Canadian healthcare globally, then I think we've done our part. So,
Mike.
Yeah, so one of the crying needs for all the clinics, including the clinics inside Walmart, are physicians, more physicians. Mm-hmm. So, and you can see some of the synergies created by having a large group such as yours. Is there anything that you have planned for assisting clinics in the recruitment of doctors? And do you have any initiatives going on? Do you actually have a person or people working for you that is helping with assisting in terms of recruiting? Is there anything that you've planned for that?
Great question. Coincidentally, Mr. Michael DeCesare is here with Jack Nathan, and he is in charge of our recruiting. He's the vice president of J&H. One of the slides I put up earlier, which had limited detail on our IMG program, you know, we've been back and forth to China now half a dozen times over the past 2.5 years. We've been to, I'm going to hesitate to say, just under 40 cities since we've been there, all over the place. We've been on medical tours. We've had surgeons join us from Humber River, Humber Valley, from Canada. We've sponsored and been part of workshops with Canadian physicians. And we feel that if you can expand globally and share knowledge, potentially we can have physicians go to other countries and showcase our knowledge and obviously how to run a medical clinic and expertise in medicine. There's no reason why we can't have physicians come from abroad, and not just from the Commonwealth countries that are acceptable and easier to get licenses for. So to answer the question, yeah, I believe that in the future we're going to see that there's some countries that have a number of physicians or too many, and some countries really have a shortage. We're hoping that we can be a conversation that levels that problem. So.
George, I want to ask you a question about a slide you had up in which you showed your expansion into Mexico, China and Brazil of next year. Are the issues facing those jurisdictions any different than they are here?
There is less jurisdiction in a lot of those areas, and especially Mexico, I'd have to say. You know, the traditional walk-in clinic in Mexico is really a lemonade stand parked outside the pharmacy. This year, they first made it law that they had to have a bathroom in the clinics. So what some of the clinics did is actually build a clinic inside a bathroom. So you can imagine what we're having to deal with regards to regulations at COFEPRIS. That's their medical regulatory body. So along comes our medical program, and obviously in conjunction with Walmart, and we present this shiny program with all these regulations and Canadian-based rules and regulations of how we have barrier-free access and wheelchair access, and here's where the bathroom is, and here's the privacy of the clinic and whatnot. And they're looking at it like, where do we sign up? Because there's really no comprehension of what or how medical clinics should look by our standards. So again, it goes back to our thought process is we really do have great standards here in Canada that we're improving on, not just in the walk-in sector, but overall in practice management, and it's getting better all the time. I think that that's something that we should showcase globally, and we can see it firsthand. I mean, there is no walk-in clinics in China. I mean, there's the government hospital, you know, and then there's private clinics. I think we walked into one in Xi'an where they have the terracotta soldiers, and it was by chance. It was the only one we've ever seen. And there was like a drape on the concrete and people like lying on the floor, you know. It's really hit and miss. Globally, from what we've seen, there is definitely a need to bring our healthcare vertical and showcase it.
Thank you.
Yes, sir.
I have two questions. One, you've said it's bad business to turn away a walk-in. I'm wondering how you do that when most of the walk-ins in British Columbia can only see so many patients a day. In fact, some in Kamloops, if you don't register by 10 in the morning, you're not going to see anyone in that clinic all day. So that's the first question. Second question is, who in the organization is responsible for the quality of care that the physicians are giving? Is that the role of the medical director as far as assessing who's working, the quality that they're able to, of care that they're practicing, and liability issues for both the medical director and the partners should there be legal action against a physician in the clinic? Thank you.
You know, those are great questions. And again, I'm going to have to say and defer that to our individual medical partners, as for us, what we do is license the space. We provide cost control on equipment. We provide access to marketing, and we in-store to social media, to digital screen. We try and put programs in place that are going to be beneficial towards the clinics, not the operation of the medical practice. We are not physicians. We provide access to patients, and we want to connect those dots. So I would have to defer that question to someone like Dr. Ian Bridger or Dr. Mann, who are both licensees of Jack Nathan Health.
Any other questions? George, if you had to come back here in 5, 6, 7 years from now, where would you see Jack Nathan Health being?
I would see a hub and spoke model. I think we've come to the point where we've understood our role in healthcare and how we could revolutionize what a medical building, referral-based medical building looks like, and shorten the gap. You know, I don't know if anyone's heard of like Medcan, that private health practice. So we're working on something on a larger scale that looks like Medcan for the masses in our learnings of what we've done, where we could have smaller clinics that actually can feed up to a hub of a larger clinic which has all kinds of services, but however are not indicative of waiting times where referrals could be drive here or come back in a week. It's all done in one day and out the door. So we're currently looking at launching about 50 of these Canada-wide, with the first two opening their doors January 2018. And those will be off-site from a Walmart, but will serve as hubs of the community. Okay?
Any final questions? I'll just ask one more. Where'd you get the name Jack Nathan Health?
So, Jack Nathan is my son's name.
Oh,
Yeah, and he may have
It's
some
as simple
shoes.
as that.
It's as simple as that. Yeah.
excellent.
Well, you know, it was funny. It was I have one of my business partners and I. We sat around and we were just thinking of names, and that just sounded great. And the comical part about it is when we do primary care or other trade shows, there is always going to be one physician that walks up to us and says, "I did some work with him." And it's impossible. Here's a photo.
Yeah.
So we get a kick out of it. There was, at the time we thought it was a great sounding name. Now, my son runs around the house and I keep reminding him that, you've got big shoes to fill. Yeah.
No further questions. Let's give a round of applause to Jack Bearcat, CEO and co-founder of Jack Nathan Health.